The European Commission have made a proposal this week on new rules for actions for excellence and trust in artificial intelligence. And your EIT, your innovation group, is working on health and AI. So you set out your paper about why it's urgent to invest in this area. So can you tell us where the benefits lie for the health of Europeans, or for citizens?
Yeah, thank you. So first of all, I think the advances there in AI and technology can really be of advanced benefit, of immense benefit, right? Both for healthcare systems by and large, but of course also for the individual patients. So I think we can see or envisage a lot of benefit for patient care, and very, very importantly, I think it can actually help alleviate workforce shortages. It might actually allow health professionals to spend more time with patients, because technology might help them to get faster and better and more efficiently through other tasks. It can also, I think, dramatically accelerate research and development efforts on potentially life-saving or life-improving treatments. And as I said, I think really allow us to reduce time spent on administrative tasks. So let's not forget, I think today 20 to 80% of a doctor's or nurse time can easily be could easily be streamlined with the support of AI. So in short, I don't think that AI is actually going to replace doctors or nurses, but it may actually replace doctors or nurses that do not choose to use it also to their benefit and the benefit of patients. So on the regulation now, particularly that you mentioned that the Commission is putting forward, I think it's we welcome it. So we believe it's a very, very important step. I think it seeks to create a sort of framework to ensure safety and also limiting any potential risks. I think for health in particular, what's really important here is that we try to minimize the added regulatory burden by actually aligning the legislation with existing one, right? For example, the medical device regulation. So I think that's really key. What I believe will be essential is it going to come fast enough? Because let's not forget, technology is moving rapidly in this area. So we need to get that security that it seeks to create fast. Secondly, the devil will be in the details in making sure that also the assessment processes that are envisaged there are really working efficiently and quickly, right? I think that's important. And then finally, looking at it from an innovation and also an investment standpoint, what we learned from our report was that a secure, good, and strong regulatory framework is seen as a key enabler for investment innovation. But I also don't think that good regulation is enough. So I think it certainly is part of providing competitive edge. So I think that's really key, but I don't think it's everything to make sure that we are keeping up also globally, right? I mean, we want to be leaders in innovation, not takers. And if we look to Asia, if we look to the US, I think strong regulation is key. It's important for our patients and citizens. It's important for industry and innovators, but I think we also need to make sure that we create stimulating innovative environments, that we put enough investment in those technologies, promote them properly, support their adoption through education training, for example. So very important step, but I think one step of probably many that also still have to follow.
There are very convincing cases to be made for innovation and use of AI and data, but there is a very real concern, and I know that that's something that the MEPs feel very strongly about privacy, about trust. What would you say to MEPs who will be looking at this proposal in the coming weeks What would you say to reassure them?
I would say that we have very high standards in Europe around data protection. I think this regulation that is now coming forward is another step in showing also how important safety will be, and I think that's embraced by everyone. And if we look now specifically at the healthcare community, I think patient safety and also safety around data is absolutely critical. And everybody knows that without putting that right front and center, we will see absolutely zero adoption. So I think that is absolutely understood also by the innovators in this space. Now, I do think though that there are a number of important steps that still need to be taken. So the Commission is, of course, also advancing other proposals, for example, around a European health data space, also the Data Governance Act, and that also treat those questions. And I think they will be absolutely key to move forward to support both, right? On the one hand, securing privacy, data security, and providing clarity in that space, but at the same time also enable innovators to move forward and utilize that enormous potential that lies in utilizing health data, both for better care as well as better research and development. And I think during the COVID-19 now pandemic, we have seen an increase in the speed of how these technologies are picked up, and also what positive impact they can have.
You talked about the data. Obviously, the AI requires good data. So do you have in Europe, do you think that we have the good quality data that is of a large enough scale and that is reliable to promote these innovations?
I absolutely, totally do think that we have that. I even think that, from my understanding, that this is even maybe one of the greatest assets that Europe has, because we do have healthcare systems that often have been harnessing this data in a very structured and good way. If we are looking, for example, up north, to Scandinavia, I think Estonia is very much leading the way, but also other countries there, we have excellent data. And I think if we manage to unlock that potential in a safe and a secure way, we have enormous potential. Of course, investments will be needed in terms of standardization, and we need to make sure that interoperability and these pieces are ensured and quality is improved. But if we want to compare also with other regions in the world, I think this is an area where Europe has already enormous potential, and we could leverage that. And let's not forget, AI and all that technology around it is not going to be worth anything if we do not manage the responsible access to high quality data, because then we have nothing that we could train those algorithms on.
You're leading the EIT group on AI and health. Can you say something about who your members are, who your stakeholders are, how you work? Do you work with the full spectrum business to patients themselves? So if you could just give me an overview of who you're with.
Yeah, sure. So EIT Health is probably the largest health innovation community in Europe. We are established as a non-profit association under the umbrella of the European Institute of Innovation and Technology. So we have a very strong link also to that body of the Commission. Now, all our members, currently 150 organizations, are, first of all, they're broad spectrum. So they're coming from industry, research, education, healthcare providers, payers, also the patient association, some of them represented. And they are all united around the mission to develop innovations for healthy living active aging, so promoting innovation for better health, better prevention, but also more sustainable healthcare system. So that's what connects us, and we support then the acceleration of new products and services to market. We're also working in education and training, so looking at how can we better train, educate the future generations of doctors, nurses, innovators, and we also support entrepreneurs, right, that are seeking to start and grow their companies.
Thierry Breton said that this proposal in some ways addresses the question of investment by providing a clear framework of what is and what isn't permitted. Do you think that will help to increase investment?
Totally. So when we looked at what did investors tell us, and we said, what are the key factors for market growth over the next 5 years? The most important piece that investors mentioned regarding Europe was an enabling regulatory environment. So I think what the Commission is doing, try to provide clarity and security in that space, that ambition is certainly spot on. But I think we also ought to remember that is not that's not everything, right? So I think we do need to make sure that what we touched upon earlier, we need to get the enabling legislation also going on data sharing and data governance. We need to look at improving system interoperability and bringing infrastructure there. We need to look at education and training. So let's not forget that we will have a need for more professionals in healthcare, right? Even if we account for adoption of AI and so on, we will need more people, and these people will need better also digital skills. And if we do not make that happen, we will have significant adoption risks. So in summary, I think it's very good to go into this direction. I would agree with this assessment that regulation is an important enabler also for investment, but there's more, and we should not stop here. No?